Hey guys, so my presentation's on Toradol injections, and I actually uploaded a PowerPoint to Blackboard if you guys want to follow along. So let's just start with what Toradol is. It's also known as ketorolac, and it's a non-selective NSAID that can be administered intramuscularly, intravenously, orally, or intranasally for short-term pain relief of moderate to severe pain. When administered intramuscularly or intravenously, it actually acts systemically as a short-term pain-reducing agent. And since its approval by the FDA in 1990, it's actually the only NSAID that's available to be administered both intramuscularly and intravenously. In sports medicine, intramuscularly is more present because it's a potent analgesic with rapid onset of pain relief, and it lasts about a half-life of 6.5 hours, which is kind of interesting. Another thing that the FDA also says is that it shouldn't be used as a prophylactic medication prior to a major surgery or an event that can cause significant bleeding, which comes into play later. So in athletics, Toradol is really brought up recently because of the NFL lawsuits that were brought against this controversial topic. Unfortunately, though, there's limited public information available on Toradol use in athletes in general. So in the NFL, which is mostly available information, a couple Lions players kind of came out and said before kickoff on game day in the NFL locker room and various locker rooms around the country, players wait in line to get in what's called the T train, which is really just the Toradol train that they would get these injections to go through the game without pain. So unfortunately, this left the perception of NFL players getting this shot up before competition. It shed an unfavorable light in the NFL as well as on the team physicians who were perceived to be complicit with the players' desire to play at all costs. So it's kind of just letting them get through pain relief, and if they can't get through without shooting up, why is that okay? Unfortunately, in the NCAA and even high school athletics in general, there's not much information besides a couple studies that say there are collegiate injections done. So let's start with the first research article. I have 3 of them we're going to look at today. The first one's by Sawyer et al., and it's just a 19-question survey that was emailed out to orthopedic surgeons and primary care sports medicine physicians. They had about 6 weeks to complete it, and whoever responded were used within the thing. So of the results, mostly were primary care sports medicine physicians, but there were 1,100 respondents, and the results are kind of interesting. 94% of them dealt with the direct care of athletes, which was really good for what we'd like to use it for. However, about 49% use intramuscular Toradol injections in the treatment of athletes, and about 79% of them in the college population, and about 43% in the professional level, which is kind of interesting because there's a lot more research on the professional level because of recent news. The most frequent sports that were really used for it were football, basketball, and soccer. So the results of the study really show that overall, intramuscular ketorolac injections were used by approximately 49% care of athletes in general, and the physicians noted that a high rate of improved pain and a low incidence of adverse reactions. So if you look at the graph on the PowerPoint, you can see that about 95 to 96% thought that administration decreased pain effectively in athletes, about 50% believe that it improved their function, and about 38% thought that it accelerated the return to activity. So a lot of the physicians that do use these strongly believe in them. And that just kind of gave us a general of who uses it, what it's really used for in general. Moving on, the next article actually dealt with intramuscular ketorolac versus oral ibuprofen, which since they're both NSAIDs, it really kind of looks towards those. This actually looked at injuries in an emergency department of adults aged from 18 to 70. And they just had minor acute musculoskeletal pain, mostly in the lower extremity, nothing too crazy. And what they did was they put together a randomized prospective double-blind model where one group was given 60 milligrams of an intramuscular ketorolac into their glute muscle and a placebo starch pill, where the other group was given 800 milligrams of oral ibuprofen and a placebo saline injection into their gluteal muscle. Pain was evaluated every 15 minutes starting at 0, and for 2 hours going up to that on a VAS scale. So results of the study actually show that mean pain scores did not differ significantly at baseline or subsequent intervals between groups. However, pain scores improved throughout the duration of the study for both groups. Unfortunately, mean pain scores were lower in the ibuprofen group during the latter intervals of the study, but it was non-significant. So if you look at the PowerPoint that I provided you guys with, there's a graph on there where you can see the pain scores going up and down through it. So in conclusion of this study, the cost of intramuscular caloric injections actually doesn't justify the routine use of caloric versus the routine use of ibuprofen. Additionally, it doesn't appear to have any significant advantage over different NSAIDs used. And in general, the perceived benefit of an intramuscular administration, so just the thought of, oh, I got an injection, so I'm going to be better, that perceived benefit doesn't justify the routine use for the treatment of mild to moderate pain. So the last article was one that I thought was super interesting, especially in light of everything that's in the news today and nowadays with the whole NFL lawsuits going on. And this is just looking at the recommendations of the NFL Physician Society Task Force on the use of Toradol injections in the NFL. So this task force got together and looked at the benefits, the risk factors, the contraindications, etc. And they just proposed the following recommendations for Toradol use in the NFL, keeping in mind that each team physician ultimately has control of their own team and can do as they feel best. So all of these things are listed on here. I'm not going to read them aloud to you. You can read them and follow along in the PowerPoint. But I think that I want to highlight a couple of them that really look at, obviously it has to be administered under the direct supervision or the order of a team physician. But what we was looking really specifically at, it should not be used prophylactically as a means of reducing anticipated pain either during or after participation in NFL games or practices. Additionally, it should be limited to players diagnosed with an injury or condition that was previously listed on the most recent injury report or following a physician-diagnosed injury that was given after that injury report was already sent over to the NFL. Additionally, it should be given the lowest effective therapeutic dose, which is 30 milligrams intramuscularly, and should not be used in any form for more than 5 days. That's the FDA's cutoff itself. And then another really important one is that intramuscular and intravenous injections of Toradol should not be used except following an acute game-related injury where significant visceral or central nervous system bleeding is not expected, and where other oral or intranasal pain medications are adequate or not tolerated. So that just looks back at the contraindications and the risk factors with that. There's a lot of, if you look through all the contraindications and the risk factors of the Toradol injections themselves, they're just like any other NSAID where they can cause issues there. And they just want to make sure that everything is kind of looked over and that these injections aren't being put to harm athletes, further preventing lawsuits down the road. So the other ones on there are just very general if you want to take a look at them. And if you guys have any questions, my references are at the very bottom, and I'd be more than happy to answer any questions you have on Blackboard. See ya!